In addition to hospitals, another setting where we also have a captive audience and we have the ability to make a difference in current and future health is within the school environment. And in this module, I'm going to focus more on the K-12 area, but of course at the university level, we can also do this as well. Okay, so this is a review from something we saw earlier in the semester when we were talking about physical activity throughout the lifespan. And this is from the Active People, Active Places BC document. So remember that the number of students that are getting physical activity at school tends to go down with higher grade level. And that's in part because, at least in BC, there is no mandatory physical education past grade 10. And this, of course, is going to affect the daily amounts of physical activity people get. So less than 50% of children, basically at any grade range, are getting the required amounts of physical activity. So this is kind of the why should we care slide, and really gives an emphasis on how school setting can make a difference perhaps. So this is from the ParticipACTION's 2020 report card on physical activity of all of Canada. And the school setting is getting a B-, which is an improvement over the years. And this is on factors like physical education, but also on opportunities for physical activity throughout the day. As far as physical education in itself, this received a lower grade, and it's a grade that has gone down since 2 years ago as well, as far as the amount of students that are getting the 150 minutes per week of moderate to vigorous physical activity. Okay. So we're not doing that well in schools, and we can be doing better, not just for physical activity, but other health-related factors as well. Okay, but focusing just on physical activity for now, as far as CPICA, the Canadian Association for Health, Physical Education, Recreation and Dance goes, their recommendations for providing a school environment that promotes physical activity is to make sure that our goal post is 150 minutes of physical education per week, which will get usually those students the 150 minutes of moderate to vigorous physical activity. Hiring qualified PE teachers, not just asking the math teacher to teach PE, but making sure also that teachers, if we want them to include more opportunities for physical activity within classrooms, that we give them the right resources, give the schools the right resources as well for facilities or education, whatever else they need to promote physical activity within schools, and collect information and fund research into best practice for physical education so we can disseminate that and then make better decisions within a school environment. So just speaking about physical education specialists, you'll notice that compared to controls, when we use someone who specializes in physical education as opposed to a trained teacher, children actually end up getting more minutes of physical education per week. Okay, so that makes a big difference, and of course, a child's physical activity levels as well. Okay. So a framework that can perhaps help us make good decisions within a school environment as far as how we can increase opportunities for physical activity is this expansion, extension, and enhancement framework. So expansion would mean that we expand basically the opportunities for physical activity. So I know, especially even in university, we spend a lot of time sitting, but can we replace some of that seat work, for instance, with, movement work as well? Can we get students to get up and stretch or do more active movement around the classroom as well? Can we also extend the amount of time that they're currently spending in physically active pursuits? So for instance, can we extend recess? Can we extend PE class? Can we extend the amount of active work as well that people do in order so they're moving their body more? Okay. And then can we enhance what currently exists? So for instance, can we enhance PE class by creating more different types of physical activity that could speak to different likes and interests? can we also make sure that we're using that time wisely? So I know when I was in elementary school, we, spent a lot of time before PE class just like hanging out. We were just like waiting for the teacher to get all the equipment ready, instead of spending that, let's say, full 60 minutes actually doing physical education. Okay, so that framework can perhaps help us get started in increasing physical activity in schools. Okay, so for instance, speaking of this concept of extension and expansion as well, when students have more opportunities for physical activity, so for instance, they have more recesses, they have longer PE classes, they tend to get more minutes of moderate to vigorous physical activity. Okay, also, and this is logical too, if we have longer times for recess, the amount of steps goes up. That's just logical as well. Okay, and I get that this is not maybe that easy to do. It depends on the framework of the school and what we can and can't do, and there's always administrative barriers to these things as well, but some food for thought in those areas. So I don't know if you know this, but the BC curriculum, high school and elementary school curriculum, had a massive overhaul a few years ago. And one of the ways that it has changed is now for each of the different disciplines, for science, math, history, etc., they have these big ideas. And these big ideas are like the main kind of visions for what we want to kind of structure everything from. So some of the K-9 physical and health education curriculum's big ideas are ensuring that there is daily participation in physical activity at various levels of intensity, for also to give people different opportunities for different types of physical activity so they can learn what they like and to find kind of that lifelong love of physical activity too. Okay, there's also an emphasis on like understanding our bodies and understanding ourselves so we can help develop that relationship for an early age. There's a focus on personal choices and social environmental factors as well. And then there is this social health part of their curriculum as well, which of course could be fostered within a health class, but could also be fostered within a PE class or just even other classes as well. Okay. So there's more of kind of a holistic focus on the new curriculum, and there is, especially in health classes, a change to, unsurprisingly, these different views and identities when it comes to sexuality, when it comes to values and beliefs and genders, etc., and an acceptance and an understanding of these things. In addition to those kind of big ideas, they also have these main curriculum organizers. So when teachers set out to build their curriculum for physical and health education, these are the main areas that the BC curriculum wants people to work on. Physical literacy, so to be able to like understand the basics of health, healthy and active living. So developing a healthy lifestyle, both in and out of school, social and community health, which we talked about as well. And I'm really happy to see a focus on mental well-being too, which I know for a fact was not even on the radar when I was a kid. And I'm not sure if it was on the radar when you were as well, but now there is that focus. So going beyond physical health, but also focusing on social and mental well-being too. Okay. For the 10 to 12, it's important to realize that physical education is not required from grades 10 to 12. It is as an elective, but there are these different classes that a lot of schools will have, and sometimes some schools have some extras as well that students can take. And you'll notice that there's more variety than perhaps what we saw when I was a kid, again, like things like outdoor education, fitness and conditioning and active living as well. Okay. So in addition to what like the BC government can do, so this is more of like a political level intervention where the BC government is saying this is how you want to run your schools to promote physical, mental, and social well-being. In addition to that, there's other programs in place that can help schools be more healthy, promote health. So an example of this, which you may have heard of, is something called Action Schools BC, which is a non-profit that really focuses on educating and providing resources to both teachers and parents on how to promote physical activity, and then there's like a food component to that as well, a dietary component to that too, okay? So it really is about, it focuses on kind of that socio-ecological theory, which we saw before, so about how children interact with each other and that setting that they do that in, and the, like I said, the environment, the setting that things take place in too. Okay, partnership approach to social change, so working with schools, working with parents, working with opinion leaders to help things get across. And it is a comprehensive school-based model, so they have many different things that schools could potentially adopt that kind of run the gauntlet of different aspects of health, although for the most part it focuses on physical activity and nutrition, okay? So physical activity, healthy eating, those are the two main focuses. So if you go onto their website, they have a number, and this is just a few of them, there's so many different ones, of downloadable classroom activities. So for things like stress reduction, like a playground circuit activity, colorful choices poster, which focuses more on nutrition, healthy minds through Tai Chi, being me, etc. These are just some of the many options there that are available both for teachers, and some are available mainly directed at parents to help again promote physical activity and mental social well-being in both the school and the after-school environment. Okay. So you'll notice when you go to their website too that this is something that's changed from the last time I taught this course, and of course because we're in a pandemic right now and more of a virtual learning setting in a lot of cases, they have a lot of online tools. So they can't really run a lot of these programs, like these physical activity programs, like they did before. So now there's a big focus into like educating parents and helping with like at-home things and increasing communication between parents and teachers to again promote physical activity and healthy eating and other healthy behaviors both at school and at home as well. Okay, so all of this that we've been talking about really does come back and speak to that active people, active places, BC, objectives and actions for Fit for Children and Youth, something we saw earlier in this semester. So one of the goals of Active People, Active Places BC for children is to increase physical activity and physical literacy for children and youth in this age group. And a lot of the things that we're going to see on this, we've already kind of hit with the new BC curriculum and things like Action Schools BC. Okay, support parents and caregivers with knowledge and skills. Okay, and provide opportunities. So that's something that the Sikapika recommendation spoke to. That's something that Action School BC spoke to as well. Enhance capacity in childcare settings and schools to provide opportunities for physical activity and physical literacy. So that's a goal, okay? So improving and building upon the current things that we have can help with that, okay? Build leadership and instructional capacity, so providing resources for schools, providing proper education facilities for schools as well, okay? And enhance opportunities for participation and support across the life course. Okay, so this kind of goes outside of the school a little bit, although it of course occurs in the schools too, but supporting those sports organizations that again can help to increase physical activity amongst children. Okay. So if you are deciding to structure an intervention that is aimed at children and youth, here are some of the things. That's a bit of a review from when we talked about physical activity in children and youth earlier this semester. We want to make sure that we have enjoyable activities, that there's a self-efficacy focus, physical literacy keeps coming up, reduce perception of barriers. Barriers is something we've talked about lots this semester. Improve parents getting involved, and this kind of speaks a little bit to me, I think a little bit about the Icelandic model and how they really, I know that's different, but they really focused on the parents as helping, as agents of change, to help with some of the initiatives that they have. More times outdoors, improved school and community engagement, and government policy. All of these are kind of like checklists that can help us make good evidence-based changes when it comes to promoting physical activity in children and youth.